Hi, my name's Louise. I'm from New Zealand. My issues started with my hip quite a long time ago. And about 8 years ago, I had an injury which caused a lot of pain, some torn cartilage, and I had to give up running and things that I used to do a lot of. I didn't have health insurance, so I had to be recommended for a publicly funded operation in New Zealand. I don't meet the criteria even after 8 years, and the osteoarthritis is quite severe. It still wasn't enough to be eligible for an operation. We did look at another option, so it was sort of between IndiCure and another company. I had already really decided on IndiCure because of the ease of communication, and something for me, I wasn't given too many choices on hospitals and doctors. I don't like having to choose things like that when I'm not the expert. I just want someone to say, this is the best surgeon, this is the best hospital, and I want to go with that one. And the fact that it was in Mumbai, I didn't want to go to another part of India. And this was the hospital and surgeon that was mentioned in an article I had read back home in New Zealand. So I was very happy to go with IndiCure. I heard about IndiCure through some publicity in New Zealand and made some inquiries. And from the very start, it was very, very easy to communicate. I asked a lot of questions. I got all the answers I needed. I was recommended a surgeon, and a hospital was sent really comprehensive bio on the surgeon and the hospital. And I was really, really impressed with what I was reading. The technology is more advanced than what I would expect in New Zealand, and the surgeon's probably a lot more experienced due to the number of people they treat and just their access to top quality training in India and overseas. I went ahead with the operation. I was picked up at the airport through IndiCure, organised us a driver, took us to a hotel corporate, which is really adequate. It's in a great location and really nice room, so many restaurants, shops and things within really close proximity. I had the surgery, was admitted to hospital, had the surgery. The post-operative, the pre-operative testing was really off the charts compared to what I would expect. They tested for everything, full health check, lungs, heart, ultrasound, CT, the lot. I was very, very confident going into the surgery. I knew I was in really good hands. I actually wanted more surgery. I wanted both my hips replaced, but the surgeon, after looking at my scans and x-rays, didn't recommend it. It's not really at a place that I do need a hip replacement, so I thought that was very good of the surgeon not to go ahead with unnecessary surgery. So I was very happy about that. So quicker recovery, and I ended up having a steroid injection in my other hip. I have got some arthritis in that hip, but it's really not a problem at this stage. I've got several more years left before I need to look at having that done. So yeah, I was very impressed and satisfied. Surgery went well as planned, and then started the recovery. Post-op checkups were very good as well. Had blood tests, urine tests, blood pressure, was given fluids if your blood pressure was a bit low, and just so helpful. The staff were great, couldn't fault it really. You do have to accept that a lot of the auxiliary staff haven't got English as a first language, of course. It can be a bit tricky, but you can always get the message across, and the people will go out of their way to help you, or get someone who can understand what you're saying. The doctors and nurses, it wasn't a problem at all. Must have had a bit more exposure during schooling or something, but overall it was very easy, wasn't a problem at all. So friendly, everything was great, food was great, and yeah, got checked out. Not before I was fully ready. It was when I was really ready to go. Pain was never really a problem. I'm on some good medication to make sure I was comfortable. And then went back to the hotel corporate, and it's been easy since then. Been out and about, even went to a cricket game. New Zealand versus India Women's World Cup was good. Been to some shopping malls. Yeah, it's been a very good experience. I would highly recommend IndiCure if you are considering having surgery overseas. And from the people I've met here, it's not just orthopedic, there's all sorts, cosmetic, obviously any surgery at a fraction of the cost, to be honest, of what you would pay in New Zealand for a lot better outcome. I'm just very happy with this decision. I can go home now, get on with my life. I was a very active person. I don't need to be running marathons anymore, but I would like to be able to walk the dog for more than 50 metres, and I will be able to. So I'm super happy just to get on with my life now and not have to wait years and years and years and years before I'm eligible for a publicly funded operation back home. Thank you.